Oklahoma City consistently ranks number 1 in the low cost of living to high wage index. Coupled with great parks, incredible museums, and consistent investment in improving, it's no wonder why Oklahoma City is the 10th fastest growing city in the United States, with the metropolitan area growing by nearly 14% over the past decade. This booming growth creates a unique set of public health challenges for the city. Tens of thousands of new workers means an influx of residents without health insurance, and a growing need for primary medical care, medication, and health education. Manos Juntas is a non-profit free clinic that's been meeting that need in Oklahoma City for more than 25 years.
The mission of Manos Juntas is to break the cycle of poverty by providing access to health care so they don't have to choose between basic needs and buying the medicines that they need to stay alive. We meet our mission by providing medical care, medications, diabetes testing supplies, and laboratory exams and specialty referrals. Patient flow in the clinic begins with signing in. They are entered into our medical record system. Then the patients are triaged. Every patient has their vital signs checked, basic medical history, and primary reason for coming to the clinic that day. All diabetes patients have their glucose tested at every clinic visit. Then they are seen by our primary care physicians, and the patient can go to the pharmacy and have those prescriptions filled.
We provide medications for free to each one of these patients. Many of the programs designed to help the poor left these people out. So we had to create a totally free clinic. Among our patients, a $4 prescription is still beyond their cost. By giving them free medication, we found that they're very cooperative. They respond extremely well, and they're very grateful for what we're able to provide for them.
One grateful person is Bob Benson, a Manos Juntas patient for more than 11 years.
Manos Juntas has been very important to me in my life because these medicines that I take are life-saving. I wasn't working and I needed my blood sugar medicines. I don't have insurance and don't have the means to get them anywhere else. If it weren't for Manos Juntas, I don't know where I would turn to get the medicines that I need. It's a place to get help when you really need help.
Manos Juntas treats a diverse population and confronts the healthcare disparities affecting them.
And during the past 25 years, we've actually seen over 25,000 patients. These patients are very diverse in their ethnicity. They come from many different countries, many different cultures, and the one thing they have in common is that they need health care.
We see patients from every socio and economic background, every cultural background, every religion. That's one of the most beautiful parts of working in Manos Juntas. The beauty and humility that comes with humanity and just taking care of each other.
We will see anyone as a patient, regardless of their background, regardless of how they got here.
One beneficiary of this open arms policy is Jorge Leon, a Manos Juntas patient for more than 2 years.
Allá en Venezuela, pues, a raíz de la gran crisis y problema que tenemos con la salud, los medicamentos y hasta los alimentos, me hizo correr hasta acá, venir hasta acá, y donde yo, pues, agradecido estoy, pues, por lo menos del gran beneficio que conseguí con Manos Juntas. El trato que he tenido, todo, con medicamentos, con todo, y hasta la intervención quirúrgica que me hicieron. Entonces, bueno, gracias a Manos Juntas, bueno, y sobre todo con lo que yo me economizo con los medicamentos acá también.
Patients aren't the only beneficiaries of the work Manos Juntas does. Each week, a large team of students gets the hands-on experience they need to be culturally competent doctors, nurses, pharmacists, and healthcare workers.
One of my goals has always been to take the volunteers and say, okay, when you get out into practice, remember what you're learning here and how these folks interact at a cultural level becomes something that they take to medical school with them.
It's just been a wonderful experience. I've been able to really understand the specific needs of patients here in Oklahoma. This is a very special place.
The clinic treats marginalized people for free, regardless of immigration status or insurance. It gives me a model for how I want to practice.
I love Manos Juntas because it is the perfect place to get hands-on experience and patient interaction.
I learned a lot volunteering here. I learned how to speak Spanish, practice more Vietnamese. Dr. Shook and Dr. Daisy were really kind to teach me every time I asked them questions.
I love volunteering at Manos Juntas because not only do you gain hands-on experience in patient care, but you also feel like you're making a significant impact on the community while you're here.
This is the perfect place for pre-health and healthcare students to get all the experience they need.
I love Manos Juntas because it gives me a place to connect and learn from my peers in the medical field.
Manos Juntas has been the cornerstone of my pre-medical experience. The opportunities that I've had to interact with amazing patients here has been the highlight of so many of my weeks.
It's also a really great way for me to help people in need that might not be able to get medical attention somewhere else.
I love volunteering here at Manos Juntas because it gives me the privilege to see how much our help is needed, and it reminds me why I want to do medicine.
Manos Juntas provides free medical care, medication, and health education to thousands of Oklahomans each year. It has saved countless lives, like Bob Benson, treats a diverse patient population, like Jorge Leon, and has trained thousands of healthcare workers, like me. I got my start in healthcare as a volunteer here at Manos Juntas more than a decade ago, and I wouldn't be the physician I am today if it weren't for Dr. Shook's mentorship and all the ways that Manos Juntas taught me to love evidence-based, patient-centered care. So I'm asking you to join us right now in saving more lives. Go to manosjuntas.net to learn more, volunteer, and donate. And together, we'll create a more thriving Oklahoma City.